Hello everybody. I am leading by example and pretty much self-quarantining. I hope many of you are able to do the same. So I am speaking to you from my home this morning. I want to thank Fredericksburg, all of you, for listening to our governor and our city. These are very, very difficult times. But you're practicing the rule of 10, you're staying 6 feet apart whenever you can, and staying home as much as you can. And thank you for supporting our wonderful businesses and our restaurants who are going out of their way to make it easy for us to order online and pick up curbside. Our city staff is here 24/7 working for you, and you will hear from Mr. Baruti soon, and we will continue to give you daily updates. One thing our Parks and Rec department is doing is publishing everyday activities that are fun activities for families to do at home. Yesterday's was a scavenger hunt. So check out their website and find, if you're running out of things to do and with a bunch of children in the home you may be, they'll help you out there. The City Council is staying informed, staying in touch mostly by phone. We are going to hold a special meeting on Friday afternoon at 4 p.m. We are going to hold this meeting using an app called GoToMeeting, so we will be online from our homes. But you will be able to view the meeting, just as you always are, on Cox, which is channel 84, and Verizon, which is channel 42, and also Facebook Live on FXBG Gov. These are extraordinary times, and these are, I know, extremely difficult for our businesses, extremely difficult for families, extremely difficult for those of you who find that your work is interrupted. We are doing everything we can to provide measures to assist. We will be talking in the future. Please stay safe. Stay in touch with your shut-in elderly. Call them. I know they would appreciate a phone call. But most of all, thank you, Fredericksburg, for doing everything you can to keep our city safe.
Good afternoon. My name is Tim Baruti, City Manager, and again, we're coming to you today to talk more about virus and the planning in the City of Fredericksburg. I am again joined by Deputy Jones and Jane Shelhorse with our Parks Department. Do appreciate the mayor sending a good message from home. Obviously, we all ask you to heed her advice. With that, I'll ask Deputy Chief Jones to update again on virus and our actions thus far. Thank you.
Thank you, Mr. Baruti. Again, we're here to try to give you the latest information to help the citizens, visitors, and employees limit your exposure and protect yourself from the COVID-19 virus. Updated statistics as of noon today: 10,692 confirmed cases of COVID-19 in the United States of America, and 160 deaths resulted from those cases. In Virginia alone, we've had 1,923 people tested, 94 positive cases. Of those 94 positive cases, 19 are currently hospitalized, and unfortunately we have had 2 deaths, which are both in the Peninsula Health District. 44 of those cases, the route of transmission is unknown, which means the likelihood of community spread is here in Virginia. In the immediate area, we still only have 3 positive cases that have been identified by the Virginia Department of Health, 1 in Spotsylvania and 2 in Stafford. There are still no positive cases for a resident of the City of Fredericksburg that we're aware of. As you can see with the numbers that I've given you, they increase daily and they will continue to increase unless we can flatten the curve. City facilities are still closed to the public, but staff remain at their desks and are working to help you either via telephone or electronically. All city services that are essential, police, fire, EMS, trash pickup, water and sewer, are still occurring as normal. The city still continues to develop contingency plans with our regional partners to cover any lapses if we have people that have been exposed to the virus in our public safety and public works divisions. Let's talk about a few general safety tip reminders for the public. Wash your hands often with soap and water for at least 20 seconds, especially after blowing your nose, coughing or sneezing, or having been in a public place. If soap and water are not available, then use hand sanitizer that contains at least 60% alcohol. Cover your cough or sneeze. Cover it with a cloth and then dispose of the cloth. If a cloth is not available, then sneeze into the corner of your elbow. Avoid touching your face, nose, and eyes to prevent transmission of the virus to you. I know that's very difficult. Most of us touch our face many times every day. Avoid contact with people who are sick. Stay home if you are sick and self-isolate from those in the household. Stay in one particular room and use a bathroom separate from the others in the home if at all possible. Practice social distancing to keep space between yourself and others. The safe distance is considered 6 feet. Avoid crowds as much as possible. Postpone any non-essential travel plans. And clean and disinfect your home to remove germs, especially from high-touch surfaces, tables, doorknobs, light switch handles, faucets, sinks, and of course your cell phone. For the elderly of our community, some additional things to consider. Make a plan now for your health care. It's very important that you do that now. If you have heart, lung, or kidney problems or conditions like diabetes, this may compromise your immune system, so take special care to avoid crowds and other people. Contact your health care provider to ask about obtaining extra necessary medications to have on hand in case an outbreak of COVID-19 occurs in your community. Be sure to have enough over-the-counter medications and medical supplies like tissues to treat fever and other symptoms. Most people are able to recover at home from the COVID-19 virus. Have enough household items and grocery on hand to be prepared to stay home for a while, and stay home as much as possible. Consider ways of getting food to your home through family, social, or commercial networks. And for all of us, check on your elders to make sure they have what they need so they can feel safe and secure at their residence. For additional information, you can go to these websites: www.cdc.gov/coronavirus/2019-NCOV, www.vdh.virginia.gov/coronavirus, or you can always reach us here in Fredericksburg at www.fredericksburgva.gov. Again, the more correct and up-to-date information we can provide will help all of us combating this virus and its effects. Now I'd like to introduce Jane Shelhorse, the Director of Parks, Recreation, and Events, to talk to you about conditions in that particular department and what they're doing to help you.
Thank you, Mike. The Parks Recreation programs, including sports, are canceled thus far through March 29th, lining up with the school cancellations. All special events are canceled through April 30th, and park rentals are canceled now through April 30th. The Dorothy Hart Community Center is closed to the public, but staff is on hand to assist by phone from 9 a.m. to 4:30, and registrations for future programs can still be done online at fredparksrec.com. Our parks and trails are open. Fishing is permitted at Old Mill Park and at the city dock, but we ask that everybody keep in mind the CDC recommendations for social distancing. And as the mayor mentioned, Parks and Recreation Department's stir-crazy suggestions will be on our Facebook page, Instagram, and website daily. So please use those to help come up with some ways that you can break the monotony if you are staying home. And right now, the weather's beautiful, so get out there and enjoy a little bit of the sunshine.